Good morning, ladies and gentlemen. I am your clinical instructor, chief instructor of Caregiving Institute, going to perform this morning the procedure we call infant care. So infant care comprises 6 procedures. One is the cleaning of the feeding bottles and the materials to be used in the milk formula preparation. And then we're going to sterilize the materials. Then after that, we're going to prepare the milk formula. Then we're going to bath the baby, feed the baby, and burp the baby. So I'm going to do hand washing technique. Okay, you identify the parts, class, no? So this is the cap or the cover. So this is the calibrated bottle. So the calibration here comes in ounces and cc. So there are 30 ml or 30 cc in 1 ounce. So the equivalent is 30 ml or 30 cc in 1 ounce. Okay, so nana siya naka marka mga numbers. Okay, so this is the feeding bottle recalibration. This is the nipple or teat, T-E-A-T, nipple or teat, and this is the ring. Okay, we're going to use a big brush for big items and small brush for small items. And this is a tongue, so there are many kinds of tongue. There are plastic and stainless. And this is a leveling knife. You can as well make use of spatula or the end of a fork or spoon. You can make use of it. And then you line them on a washcloth or any kind of cloth. They should be aligned. Okay, now I'm going to add water. Okay, rinse them. Rinse them. You can either make use of brush when rinsing or not yet. Then you pour it. Add additional soap. Additional water rather. Then you add soap. Detergent soap. Then you make a lather. Then you brush small items with a small brush. Okay, clean the groove very well to remove milk curd. Milk curd is spelled C-U-R-D. Then the cap or the cover, still using the small brush. And then the nipple. Then put small amount of soapy water and squirt it, S-Q-R-T, squirt, to remove milk curd in the hole. And then the bottle. Small brush in the rim, then big brush on the inside part of the bottle and the outside part of the bottle. Okay, the tongue you will also clean using small brush so that you can reach the groove. Then the leveling knife. Then after soaping, you throw the water, then you add more water, and then you rinse very well. Rinse them very well. Yes, you rinse very well. So have to remove the soap, no? For safety of the baby. Okay, so after cleaning the bottle and the other materials that you're going to use in milk for milk preparation, we're not going to sterilize it. We have 2 types of sterilizing pots, guys. One is the manually operated and the other one is the electrically operated. Then we clean it very well and then we add water. The volume of water depends upon the number of items you're going to sterilize. So this bottle should be placed here on the hole and then the small items at the center. And then the tongue, the sides, including the spatula. We don't include the nipple since it is made of silicone. It will easily melt. And then you cover it. Put it on top of the oven. Turn it on. Then we start the sterilization time, class, 20 to 25 minutes after boiling point. Again, we count the sterilization time 20 to 25 minutes after boiling point. Then we turn it off. 25 minutes has been reached. Then every time you put the cover on the table, it should be upside down. Then you drop the nipple. Drop. Then you cover it. Extend for an additional 5 minutes without turning on the oven, on the stove. Okay? So I have here a basin. We have different types of basin: stainless, aluminum, enamel, and plastic. So this is a kind of stainless basin. So it should be previously sterilized. If it is made of plastic, it should be very clean. 5 minutes has been reached, so you open it upside down. Let it cool. Let it cool since you're going to pick the tongue. Then you pick the bottle first. You can hold the outside part. Put it inside the sterile basin. Then you get the leveling knife. You can hold the outside part of the leveling knife. Then put it inside the basin again. Then you get the ring. You hold it the outside part. By the way, class, if an accident will happen, what kind of accident? One part or several parts of the feeding bottles or other materials that you need will drop. You might as well defend yourself. You will tell the assessor, ma'am, if this accident will happen, I'm going to clean it again and re-sterilize. But if I have reserved sterile materials, I'm going to make use of the sterile materials that we have stored. Okay? And then the nipple. Where's my nipple? The nipple is done. Nawa ang nipple? Here. So the nipple, you assemble it. So you can notice, class, I'm assembling it on top of the pot or on top of the sterile basin. In case it might drop, then put it on top of the bottle. Then, pick the cover. Okay. Now we're going to proceed in milk formula preparation. Okay, hand washing technique done. So, you have to read the order of the doctor, what kind of milk formula the baby is going to use. So, before opening this one, or if it's already open, if it's the first time you handle the baby, it's a must that you have to read the label, class. The label, the expiry date, you check the integrity of the can or of the box. It comes in box, right? It's preparation of milk formula, or the storage or the preparation of the milk comes in box, plastic, or can. So you have to check the integrity of the packaging. The formula preparation, class, the ratio is 2:1, where 2 is 2 ounces of water and 1 scoop of milk. And there are different kinds of water that you're going to use: distilled water, mineral water, or previously boiled water. Okay, hand washing done. I'm now going to start the milk formula preparation. Okay, open it without detaching the cover. This is sterile. You have to pour first the water because according to the law of physics, class, if you're going to make use of a fluid, solution, or a liquid, you must pour first the liquid form and then followed by the solid form in order not to be mistaken in the volume that you want to acquire. So we have to pour first the water. So as we said, the volume or the ratio is 2:1. But depending on the age and the size of the baby, you have to read the instruction on the can. Okay, now I'm going to pour the water, 2 ounces. Then after that, open upside down. Get the scoop. Do not tuck it. Do not do like that. You just level it. Using the blunt side of the knife. Blunt. It's not the sharp side. It's the blunt side. Okay, so you have to remove the excess powder. Then you pour it. Okay? Then after that, you're now going to cover again. So shake gently the mixture to avoid air bubbles which will cause abdominal pain or abdominal colic. You shake it this way, gently, pump in between the palm or in a circular motion. Do not do it like this because excessive bubbles or air might be created which will cause abdominal pain or abdominal colic to the baby. If I'm going to, if I use the previously boiled water, I must submerge it in a water in a room temperature in order to cool it. If I'm using a distilled water or mineral water, I'm going to submerge it in a warm water in order to warm the milk. So that if the baby is going to be fed, the water should be lukewarm. Okay? So set this aside. Then remove everything that's not needed anymore. Now I'm going to prepare my child or the infant for bathing. So before preparing anything else, we have to check first the temperature of the baby. Since if the baby is febrile, we cannot bath him. We will do the therapeutic bath, which we call TSB or tepid sponge bath. So if the baby is febrile, we have to do the therapeutic bath called TSB or tepid sponge bath. So I'm going to transfer in a sterile candy basin at least two cotton balls first. Then cover immediately. Then pour with alcohol. Then the proper use of thermometer glass before using. You check if it is working. Then you're going to clean it from tip or bulb in a circular motion going to the stem. Do not wet the monitor, you might destroy it. Okay, single stroke, then discard. And then I'm going to put it on the axilla of the baby. So if you have a tympanic thermometer, so you make use of a tympanic thermometer on the ear. So the preference usually in taking the baby's temperature is the tympanic thermometer used in the ear. But we have here a digital thermometer which we usually make use in our home, which we going to take the baby in his axilla. So the baby is febrile, so we can bath the baby. Then we're going to clean it again, this time from stem to tip or bulb in a circular motion, then drop. We can now prepare everything that we need when bathing the baby. So a towel should be placed on the table to pad the tub under to avoid accidental slipping or falling of the tub. So we put it here. Again, to avoid accidental slipping of the tub. And then we have here the body soap. And then we prepare one basin. Then we pour lukewarm water on the tub and on the basin. So the depth of the water on the tub depends also on the size of the baby. And then we pour also on the basin another lukewarm water to bath the baby's head. And then in testing the temperature of the water, we might as well make use of the wrist or the inner aspect of our forearm. So I prepare my wrist. Okay, good, good. Then I'm going to prepare something soft which will protect the baby's back later on when we bath him. And also to protect the table from getting wet. So prepare cotton balls. You place it on the sterile in the basin to clean the baby's face, neck, and eyes. And then we pour this one with lukewarm water. Lukewarm water. We pour it with lukewarm water. Okay. Then we're ready now to carry the baby from the crib. Protect the baby's neck, always, to avoid cervical fracture. Again, always support the nuchal area or back of the neck of the baby to avoid cervical fracture. So put baby on the padded table. So You can remove immediately the bib. You might forget to remove it when you're going to clean the neck. So, no gloves during infant care class. No gloves. So, hold the baby's forehead, inner to outer canthus, other side of the cotton balls, inner to outer canthus, discard. To remove the baby's mouth, always start from the inner canthus, inner to outer canthus, inner to outer canthus. Always start in the inner canthus to avoid cross-contamination. Then we're going to clean now the face. We start on the forehead, cheek, bridge of the nose, other side of the cheek, chin. We go behind the ear or back of the ear of the baby. Squeeze excess water, clean the pinna. Drop. Then we go to the other side, forehead, cheek, under the nose, other side of the cheek, chin, behind the ear or back of the ear. Squeeze excess water, pinna. Now we go to the baby's neck. Wash, turn, wash. Okay, if you want to repeat it, you can do it. You notice I did not apply yet soap. So never apply soap in the baby's face class, never. And then after that, you're going to pat dry using a clean washcloth. Dry the baby's face and neck. Now we proceed the baby's head. Remove down the cap. Okay, hold the baby in a football hold. Or position the baby in a football hold. Clip the baby on your axilla so that he will minimize moving. Then the baby's head should be lower than the body. And then don't forget to flip, F-L-I-P, flip the baby's ears. Or if the baby's head is quite big, you might as well put dry cotton balls in the ears to avoid accidental entering of water on his ears. So wash. Okay. And then you soak the baby's head. Soak. So massage using the pads of your fingers. Massage, then you rinse. Massage. Don't forget to include the back of the head, then rinse. So wash, soak, rinse. And then using the washcloth that you use in patting dry the baby's face and neck. Carry the baby, put him back on the table. Dry it well. And then you let the baby's head lie on the washcloth that you use in patting dry the head. And then don't forget to put immediately the cap to avoid congestion. Congestion class causes what? Colds and fever. Congestion. So you immediately replace with a new cap. Then you can remove this already. Then after that, we go down to the baby's body or we go to the baby's perineum. Okay, covering the upper part of the baby's body, we now open the lower part. Remove the booties. Booties or others make use of socks. And then you remove the undergarments or pajamas. Now the diaper. So if this part of the diaper is clean, you can as well make use of this one for initial cleaning of the baby. So our baby is a male. So we start now with the penis. Clean it well. Then we go to the scrotum, under the scrotum. Then one side groin, the other side of the groin, we make use also of this clean part. And then after that, we fold this one and let the buttocks of the baby lay on top of the clean outside part of the diaper. You lift the baby's leg slightly. Then you pad the buttocks with the clean outside part of the diaper. So again, you let the buttocks lay on top of the outside part of the diaper. Then you continue cleaning using cotton balls with water. lukewarm water. Okay, clean. Again, penis, scrotum. You go to the anus, of course. And then you dip the baby's legs. Then you go to the anus, buttocks, and gluteal folds. Okay, you repeat. You repeat. Okay. Okay, after that, no need to pat dry because you're going to clean the entire body of the patient or the baby. Then you roll this one. Proper disposal of the diaper should be needed. So you apply the Velcro, then set it aside. Okay. Now we're ready to bath the baby's body. So put towel across your chest. Remove the baby's flanella. And then the shirt. Okay. Remove the shirt. The other side of the shirt. And the mittens. Then cover first the baby because you're going to prepare before bathing the baby's body with a new flanella. So prepare a new flanella. This flanella has no hood. You can as well create your own hood. And then on top of the flanella, you put a shirt. And the diaper. Shirt. Then the diaper. Okay, now carry the baby on the top. Remove the flanella. Okay, so carry the baby, protect the baby's local area. Then remove the flanella. The towel across your chest will be used in wrapping the baby after bathing and also to protect yourself from getting wet. Okay. So you follow or you position yourself in a hollow part of the bathtub. Then in a semi-reclining or semi-sitting position, you position the baby inside the tub. And then you wash the neck, the shoulders, the axilla, the chest, the arms, the hand. Pay attention in between the fingers, the other arm, then hand. In between the fingers, you pay attention, chest, abdomen. Then you go now to the perineum, the groin, the penis. And then the thigh, you go down to the legs, popliteal area, go down. Then the feet, pay attention in between the toes. Then you apply soap on your hands, not directly on the patient's or the baby's body. Then you do the same sequence in applying the soap. Then after that, you rinse the baby's body very well. Remove the soap to avoid skin irritation. Rinse the baby's body very well. Then in cleaning the baby's back, you transfer the baby from the other hand or other arm. Again, in a semi-prone position, you now clean the local area, shoulder, arms. Then pay attention on the baby, on the creases of the baby's body. Then you go now to the buttocks, the gluteal fold, and then you go to the popliteal area, and you go to the feet. Then you apply soap, the same sequence. Okay, apply soap. Then you rinse the baby's back very well. Remove the soap to avoid skin irritation. After that, you put the baby, you let the baby rest on your chest, and then wrap the baby immediately to avoid chilling. Then put first the baby away from the new flanela. You lay the baby on top of the table. Dry the baby's body very well. Pay attention on the creases and in the axilla, in between the hands, the groin, and then you go down popliteal area and in between the toes. Dry the baby well. And then after drying, you transfer the baby to the new flanela, leaving the moist towel behind. Protect the head or the neck. And then you put the baby here. And then you wrap first the baby. Do not dress first the baby since we're going to clean first the nose, the ears, and the umbilicus. In cleaning the baby's nose, we make use of a slightly moist cotton buds. Okay, pour with water only, both sides. Then to get the mucus or remove the mucus and the booger, we clean the baby's nose with one nostril. Then the other side, the cotton buds, the other nostril. Nostril, nostril. Then discard. Then we're going to get another cotton buds. This time it should be very dry to clean the baby's ears. Okay, so clean the baby's ear. Do not insert the cotton buds deeply. You might puncture the eardrum. So, the other side, the other ear. Then discard. Now we proceed in cleaning the umbilicus. We prepare new cotton balls. Say cotton balls, pour with alcohol. Then expose the baby's umbilicus. So of course, hand washing, then you put alcohol, 70% alcohol in your hands before picking the cotton balls with 70% isopropyl alcohol. Then you clean the umbilicus. You concentrate on the center of the umbilicus in a circular motion. Then you go out, make a big circle. Then you discard another cotton balls with alcohol. Concentrate on the center. Then you make a big circle. Discard at least 3 times, class. Now we're ready to dress the baby. In dressing the baby, we start on the shirt. Of course, the mittens first, to avoid from the baby from scratching his face. So it should be worn wrong side out. So again, the mitten should be worn wrong side out to avoid accidental cutting of the baby's fingers. And then you insert one armhole of the shirt. Cover. Then you go to the other side, the mitten, wrong side out, to avoid accidental cutting of the fingers. Then insert the other armhole. Now you tie the cord. Okay, make a ribbon for easy removal later on, or for easy untying later on. We're going to dress the baby again. Then class, avoid inserting the shirt under the diaper. Again, avoid inserting the shirt on the diaper because it might cause pressure and might irritate the umbilicus. Okay. After that, we're now going to put on the diaper of the baby. It has been prepared a while ago on top of the flanela. So if your baby is a male class, be sure that the length of the diaper in front should be longer than the back, because when the male will urinate, the tendency of the urine will go up and it will moisten the front side of the diaper. So it should be longer. When your baby is a female, the back side should be longer because the tendency of the urine will flow back. Again, do not insert the shirt under the diaper. Okay, after that, you now put on the undergarments or the pajamas. Do not insert the shirt under the undergarment or pajamas. It should be loose. It should be loose. Okay. Where's the diaper? So the shirt should be loose, hang loose. Okay. So I'm now going to put the booties or the socks. Booties. Wrong side out again to avoid accidental cutting of the toes. The other booties, wrong side out again. Avoid accidental cutting of the toe. Okay. Now I'm going to rock the baby. Rock the baby, mummify or swaddle the baby. Swaddle is spelled S-W-D-D, S-W-A-D-D-L-E. Mummify is M-U-M-M-I-F-Y. Mummify. M-U-M-M-I-F-Y. Okay. So you cross on the other side, you fix first. Then you cross the other side. Then this arm should clip the one side of the flanella. Then alternate, you pull it up. Then you cross the other side of the flanella. So this is swaddling, mummifying, or wrapping the baby. Okay, put now the bib since we're going to feed the baby. You tie the bib at the side so that you will have no difficulty in tying it. Tie it to the side. Take a ribbon. And after that, you put burping towel on your shoulder. Burping towel. A preparation for feeding the baby. Oh, for burping the baby after feeding. Yeah. The best position of the caregiver when feeding the baby is in a sitting position near a table, while the baby's position should be on a semi-reclining or semi-sitting position. I will now get the adult bird. So this is my table, armrest. Then I'm going to open upside down again. Then if it is a previously boiled water, you have to check the temperature of the water. Ano na lang kayo? Lupad. Okay, you test it at the side of your hand. Do not touch the nipple of your hand. Okay, the temperature is fine. Now I'm going to stimulate the rooting reflex, R-O-T-I-N-G, using my small finger. You put the small finger at the side of the baby's mouth. The nipple should be near already on the baby's mouth. So that once the baby will open the mouth, you immediately insert the nipple. Be sure that the nipple is filled with milk to avoid air or bubbles, which will cause again abdominal pain or abdominal colic. Once the baby is done, put your small finger at the side of the mouth, and then once the baby opens his mouth, you pull the nipple. Then cover it immediately. Now we're going to burp the baby. 3 ways to burp. One way of burping is the shoulder burp. The abdomen of the baby should be against my shoulder. Then massage the baby's back. Observe the baby for signs of choking like cyanosis or bluish discoloration of the face and the mucosa, dyspnea or difficulty of breathing, difficulty of crying, difficulty of coughing, glaring of the eyes, and restlessness. Okay, the second way to burp is the sitting down burp. You transfer the burping towel at the crook of your arm. The pressure of the abdomen should be against my forearm. Again, observe the baby for any signs of choking. And then you can as well massage the baby's back while observing the baby. The third way to burp is the lap burp, L-A-P, lap burp, or prone burp, P-R-O-N-E. So the baby's abdomen should be against my thigh. The head should be lower than the body. My burping towel is the crook of my arm again to avoid soiling of my pants once the baby might vomit. Then massage the baby's back. Observe the signs and symptoms of choking. Now I'm done. Before returning the baby on the crib, you have to check the diaper if the baby has defecated, so that you might as well change the baby's diaper immediately. And then you also check the crib for any presence of small and sharp objects, presence of insects. Avoid excessive pillows. Why avoid excessive pillows? The baby might be moving inside the crib, and the pillow might be placed on the face, and he doesn't know how to remove it. So the baby might suffocate. By the way, class, that crib is not ideal for infant. That is for the newborn. The one for infants is the bigger ones inside, the bigger ones. Okay? Now I'm going to position the baby on the crib. In a semi-reclining or Fowler's position. But if the crib has no like this, you can as well add pillow. Then you observe the baby for a while before leaving. Then raise the side rails and lock. I'm done. Thank you.